Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bosundharadi Medical College. Dear student, welcome to you all today's pathology session. In our previous lecture, I have already discussed about the causes of microcytic hyperchromic anemia, and we already discussed about the metabolism of iron. So in this class, I am going to discuss the causes of iron deficiency in our body. So the major factor in pathogenesis of iron deficiency, number one, increased the pathological demand for iron. Number two, due to pathological blood loss. And lastly, inadequate iron intake. According to the age and sex, in female, during the reproductive period, the iron deficiency is more common, and the most common causes are those women who have heavy menstrual blood loss. And during pregnancy, the women who have many pregnancy in rapid succession or miscarriage, they have developed iron deficiency. In case of infant and children, due to deficient diet or due to diminished iron store at birth, the iron deficiencies occur. The most common question in your professional examination, that is, what are the pathological causes of iron deficiency? So, due to chronic blood loss is one of the most important causes of iron deficiency. It may be due to the uterine cause or gastrointestinal cause. In gastrointestinal causes, it may occur due to peptic ulcer or esophageal varices, due to aspirin ingestion, or due to partial gastrectomy. The iron deficiency also occurs due to the carcinoma of the stomach, carcinoma of the cecum, carcinoma of the colon or rectum, in children due to hookworm infestation, and the other causes include angiodysplasia, colitis, piles, diverticulitis, and rarely due to hematuria, hemoglobinuria, pulmonary hemosiderosis, self-inflicted blood loss. Now, dear student, come, how can we diagnose a case of iron deficiency anemia? The iron deficiency anemia can be diagnosed in two steps. At first, we have to examine anemia occur, but is it due to iron deficiency? And then we will determine what are the causes of iron deficiency in our body. So, in case of diagnosis of iron deficiency anemia, you have to examine at first the clinical features of iron deficiency anemia. Then we will examine the blood examination. And lastly, we will examine the therapeutic response with iron therapy. So, what are the symptoms of iron deficiency anemia? The most common symptom is anemia. You know, there are some changes in long-standing chronic iron deficiency anemia that include colonychias, atopic gastritis, angular stomatitis, and the Palmer-Vinson syndrome. And this Palmer-Vinson syndrome includes chronic iron deficiency anemia, dysphagia with glossitis, and post-cricoid wave. In this picture, in the first picture, it's present that the presence of colonychia in the nail bed, and the second picture that represents a patient having angular stomatitis, and lastly, in the picture C, it represents the post-cricoid wave of the patient. So, what about the blood picture? At first, in anemia, we will at first examine the hemoglobin concentration, and you will see that the hemoglobin concentration will reduced, and then the total count of red blood cell it also reduced, and then the red cell indices, that means the MCV, MCHC, and MCH also reduced. And lastly, we will do the peripheral blood film, and in peripheral blood film, you know, we will examine the size and shape of the RBC. So, in case of iron deficiency anemia, we will find microcytic hyperchromic blood picture, and also there are presence of pencil shaped polychromocytes. This is a picture showing the microcytic hyperchromic anemia that mainly occur due to iron deficiency anemia, and there are presence of many microcytic, that means the size of the RBC is reduced, and hyperchromic, the central payload of the hemoglobin is increased. So it is microcytic hyperchromic red blood cell, and also there are presence of some pencil shaped cell, and this pencil shaped cell is significant in case of iron deficiency anemia. And what are the other findings? We will also see in the RBC there are presence of elliptical form, elongated pencil shaped cell, and also presence of target cell. And the WBC and the platelets are normal. And then we will confirm the iron deficiency anemia by examining the serum iron profile. So in serum iron profile include 4 components, that is serum iron level, then total iron binding capacity, then we will examine the percentage saturation, the serum ferritin level, and lastly the RBC protoporphyrin. So the serum iron profile, in case of serum iron, we will see that the serum iron level is reduced less than 2.5 to 10 micromole per liter, and as the serum iron level is increased, so the total iron binding capacity will increase, and it is up to 100 micromole per liter or more. As there are reduced the serum iron level, so the percent saturation will also reduced, and it is about 10 to 15%, and the serum ferritin level is less than 12 micromole per liter, and the RBC protoporphyrin is increased more than 100 to 600 microgram per dl, and the normal range is about 20 to 40 microgram per dl. And lastly, we will examine the bone marrow. So in bone marrow examination, we will see there are presence of erythroid hyperplasia with micronormoblastic changes, and we will also see the iron status in bone marrow, and it is examined by using Prussian blue reaction with ferrocyanide, and we will find that the iron status is reduced or absent in the bone marrow. And this table represents as a whole the microcytic hyperchromic anemia, and we can differentiate the 4 causes of microcytic hyperchromic anemia. You know that the microcytic hyperchromic anemia mainly occur due to the iron deficiency anemia, chronic inflammation or malignancy due to thalassemia, and sideroblastic anemia. And in this table, if you see that there are MCV and the MCH level is reduced or mildly reduced in 4 of the cases, and in the serum iron level is reduced in case of iron deficiency anemia and due to anemia due to chronic inflammation or malignancy. But in case of thalassemia, either it is alpha thalassemia or beta thalassemia, the serum iron level is normal, but in sideroblastic anemia, the serum iron level is raised. And so the total iron binding capacity also raised in case of iron deficiency anemia, reduced in anemia due to chronic inflammation, and normal in thalassemia and sideroblastic anemia. The serum ferritin level also reduced in iron deficiency anemia, but normal or raised in anemia due to chronic inflammation, and normal in thalassemia and raised in sideroblastic anemia. And then if you examine the bone marrow, the iron store is absent. You have to remember that the iron store is absent in case of iron deficiency anemia, but the iron store is present the other causes of iron microcytic hyperchromic anemia. That means in chronic inflammation, thalassemia, and the sideroblastic anemia, the iron store of bone marrow is present. And then in erythroblast iron, if we examine, that is absent in iron deficiency anemia and chronic inflammation, but present in case of thalassemia, and there are ring form in case of sideroblastic anemia. And lastly, we will examine hemoglobin electrophoresis. So hemoglobin electrophoresis is normal in iron deficiency, in chronic inflammation and sideroblastic anemia, but raised hemoglobin A2 level in case of beta form of thalassemia. That's all about the iron deficiency anemia. Then the next causes of microcytic hyperchromic anemia, that is the chronic disorder. And what are the chronic inflammation or chronic disease that causes microcytic hyperchromic anemia, you have to know. So in infection, in pulmonary abscess, tuberculosis, osteomyelitis, pneumonia, and the bacterial endocarditis is the main cause. And in non-infectious condition, like rheumatoid arthritis, systemic lupus erythematosus, and other connective tissue diseases, sarcoidosis, Crohn's disease and Gaucher disease are the most common causes, and the microcytic hyperchromic anemia also occur in some malignant condition like carcinoma, lymphoma, and sarcoma. So that's all about today's lectures, my dear student. Inshallah, see you again in our next class. Till then, Allah Hafiz.